Dignispace is an online resource essentially for health and social care practitioners. So it started out being, it was prompted by nursing students and research that we did with nursing students, but really it's for any health and social care practitioners.
We used an interdisciplinary approach, which again I personally believe is very important in any education, especially in today's health and social care scenario, because health has a much broader definition than just the absence of illness, and well-being is very much part of health as well.
A key part of what we wanted to achieve was to have an area, a prompt for reflection that would allow people to think more deeply than they might otherwise have had the opportunity to do about dignity in care, and what those look like through the lens of a human rights-based approach. Dignispace is structured around the panel principles, which are familiar to many of us in Scotland: participation, accountability, non-discrimination, empowerment and legality. And it's based on 3 levels of learning.
So it's an online resource, I think the first of its kind in many ways. First of all, to use the human rights lens to examine dignity and to empower practitioners to advocate dignity in practice. Secondly, I think it's the first project that has involved students as part of the co-production.
Before I used Dignispace, I thought dignity was about making sure people are covered up, and it was something that we had to consider, and I didn't realise how much there was behind dignity. I didn't think about the legal aspect or the accountability aspect or empowering people or giving them.
Yeah, I think the empowerment's really important, isn't it? It's been a bit of an eye-opener, which is, really good.
When I'm, when I'm practicing as a professional now, I can go on my level that it's just not the NMC, it's just not that you are bound on these principles and rules, because you know already that dignity, treating people with human rights is like, it's a kind of, there's a power in it.
Instead of just having that word dignity there, that everybody knows what it means, but instead of just having that word dignity, you're thinking about more giving people autonomy, shared decision making, and you're integrating it a lot more into your care. And with Dignispace being the way it is, you can always revisit it.
Yeah, for me as well, I think building on confidence as well, you feel a lot more confident and a lot more well informed on the subject, and also on wards you can spread that knowledge that you've learned as well, which I think is really important. Spread it amongst your colleagues and fellow students, and it's really good for that way as well.
I've been in touch with Dr. Jane Douglas, who's with Scottish Care, who oversee all the private care homes in Scotland, and Jane has a very specific role. I think it's transforming nursing roles lead, and she's very keen to adopt this for Scottish Care as well.
I felt that it's such an important subject. It's something that we need to, and we are embedding in our rights-based models. So it's really important for people to understand what we mean about human rights and the rights of the person, and what that means when supporting somebody. And sometimes we talk about it generically as if everybody understands what that means, and I think this offers a bit more in-depth understanding, but it's delivered in such a way that it was very user-friendly.
Well, what we conclude is that actually, much more than being a theoretical or academic exercise, it had a real impact on practice, professional practice of nursing students. So what we've concluded is actually we need to look at how we can expand Dignispace from just being a module within one university to across nursing education generally, and particularly as we go through the rights agenda into the implementation of human rights, actually ensuring that all healthcare professionals have this understanding and training as part of their professional practice.
So now we need to continue to roll it out and understand how people are using it, understand how it's benefiting their practice. And really, I think there is a very strong network of people who understand a human rights-based approach in Scotland. So I think we're quite lucky to have really fertile testing ground in Scotland.
So from 2021, students have had access to this resource, and I know that this year it's been continued. Since I moved to Edinburgh, I've introduced it already to the Edinburgh nursing students, and again there's been great interest in kind of adopting this as part of the curriculum.
We would love to get feedback on how it's being used and the impact that it's having. So it's really about trying to promote it and embed it as much as we can so that we can start to understand the impact that it's having on practice.